The fact is, 72% of aviation accidents before CRM were attributed not to technical failures, but to human failures. And it's not to say that the human is incapable of performing these tasks, but rather in most cases that they were inadequately trained. Think back to the 1980s. There were many aviation accidents. With the help of the FAA and NASA, we introduced human factor training programs. And now most airlines have been operating at 0 errors. Within healthcare, JACO's reporting that 76% of preventable medical errors are attributable not to technical reasons, but to human factors issues. So what can we do to combat these tragically high numbers? The IOM, the Joint Commission, the Institute for Healthcare Improvement, the FDA, and numerous safety foundations have recommended embedding human factors training into the hospital environment. Several hospitals have already witnessed dramatic reductions in human errors. Some are even reporting 0. What makes CRM work? Apollo CRM training is designed to give your medical teams tangible, practical skills they can use every day on the job. These skills are simple, and when applied correctly, can pay high dividends and make a large difference in the way your team functions. One of these skills is the timeout briefing.
Hi, I'm Pam, and I'm a real nurse in a hospital. If for some reason we miss something, which so far the situational awareness training and common language have not caught, we have another backup. We think like NASA now, backups. The timeout briefing. If you notice, I said the timeout briefing, not just timeout. That's because it is a briefing, not just a timeout, and it is delivered by the surgeon, period. It looks like this at my hospital.
Okay team, I'd like to do our timeout with Mrs. Sarah Johnson for a right knee total knee replacement. Allergies to penicillin. Does everybody agree?
Agree.
Has she gotten the preoperative antibiotics?
Yes.
Do we have the implants?
Yes.
Are the implant reps available?
Yes.
And we have all the equipment?
Yes.
Okay, if there's any concerns, please let me know.
Okay. Thank you. Thank you.
The timeout briefing is now mandated by JACO. It was one of those skills migrated from aviation. If done correctly, it can make a huge difference. This is the initial first step for a team to come together. It sets the tone for the entire medical procedure, and it's the basis for all following communications.
I feel that the timeout brief is very important. Prior to the Apollo Project CRM, we did not do a timeout on a routine basis. If the nurse didn't initiate it, it just went by the wayside, and that leaves us open for mistakes. Now that we are doing that, every single case, the patient is more protected. There's better safety for the patient.
You can clearly tell of the staff who's done the training and who hasn't.
The Apollo project for the timeout briefing has been very successful because now even the scrub techs will stop and say, wait, did we do a timeout? Because they may have missed it. But the physicians ask, after they do the timeout, they ask if everybody in the room is in agreement. And so it's nice because everybody is involved, and we usually even try to include the patient and have everybody in agreement prior to the patient going to sleep.
I think the timeout brief, as a team, it empowers everybody to take an active part in the timeout process. It allows the entire team to take an active role in patient safety.
The Apollo project for me has kind of opened new doors. Before I was always afraid to speak up, kind of stood back, watched everyone else go to the forefront. Now I feel that I have some ammunition behind me.
Well, it's definitely is noticeable of the people that have done the training.